So this is the first of our kind of ramblings, not the first conversation, but we're doing this because when we do converse, we tend to span a spectrum of science, philosophy, anecdotal experience, and taking the whole world with regards to our lives, what we do, and how we help people. And I think it's really important that we can shed a little bit of light on what we do as passionate people and osteopaths, because a lot of people ask us, what do osteopaths do? What is an osteopath? And we work in completely different environments, probably with different patient demographics, but we get asked the same questions. So I think it's important that we can shed some light on it from both of our individual perspectives and help people understand what we do better and direct them to treatment that can help some of the most common conditions that we see. So Mo, it's great to see you, bro. It's been a long while, and I think we should just get into it. So first of all, let's talk a little bit about what you do, where you work, the type of people that you see, and some of the most common things that you treat. So you don't have to go into lots of detail, but just give us a kind of a landscape and set the scene for what we're going to talk about.
Yeah. So thanks for having me here. Always good to see you, first of all.
My pleasure.
So just basically, it's good to say that we train together and basically we receive the same formal training. At the moment, I work in London and I work in both NHS and private practices.
So
and basically,
yeah?
National Health Services, yes, that's correct. Obviously, quite a few differences in the way we might approach the logistic, let's call it, not bureaucracy, but the different environments. But that's what I do, and I'm a musculoskeletal osteopath. It's good, I think it's good to underline and stress this, because we know that osteopathy encompasses a broad spectrum, a broad church of activities, visceral, cranial, structural. These are all terms, just they tend to delineate a certain type of approach. But having said that, I'm a musculoskeletal therapist, so I encounter patients with a vast array of clinical conditions, mainly musculoskeletal, so neck pain, lower back pain, peripheral problems, so shoulders, knee problems. But having said that, we have realized, I can say that at the end of the day, we are in front of a person with their complexity. So we're in front of a person that is that deserves, that requires, that is there for our help from a omnicomprehensive point of view. And that's what osteopathy, I don't know if you agree with me, that's what osteopathy can offer as an omnicomprehensive, patient-centered therapeutic approach.
Absolutely.
So that's what I do basically. I mainly do musculoskeletal treatment, but definitely, obviously there are elements of psychosocial support, like I dare saying, an element of advice on lifestyle, so diet, nutrition, exercise, big one.
Yeah.
So that's what we do.
Yeah, I mean, what you've mentioned there is this spectrum of modalities that we use to treat the person, not just the symptoms. And we could term that under the umbrella of a generalist or integrative or holistic approach. So looking at the person and the factors that drive their symptoms, as opposed to just trying to address the kind of presenting symptoms. Now myself, I work in a completely private setting. I'm in the Middle East. I'm in Doha, in Qatar. I came here in August 2019. And so I am in a completely private setting, not a national health service. So I see, how would I say, yes, mainly musculoskeletal presentations. So just like you, lower back pain is probably the most common, and is probably the most common for most osteopaths.
Yeah,
And neck pain. I see the occasional sports injuries, knee pain. But what I often see is these common driving factors behind these, these presentations. And
absolutely.
a lot of the time, these are non-traumatic. In fact, the vast majority of these situations are non-traumatic, but they are chronic in nature. So there are these lifestyle factors, as you mentioned, that are driving these conditions. And I think one thing that we have a very common we have a very common affinity with is understanding what is the root cause, what is driving this. And this is why we look at the person, and instead of just trying to go for a quick fix that leaves the patient feeling better for an hour or a day, we try to go that little bit deeper. And we use our hands, we use our training as an osteopath in order to kind of build that rapport, build that relationship where we can go that little bit deeper. And yes, we're osteopaths and we label ourselves as musculoskeletal therapists, but I find that more and more I'm using my title to delve into the realms of positive psychology, into motivational, motivational coaching, health coaching, nutritional advice. My background is in exercise and motivation, so yes, exercise comes into it as well. But what we're saying overall here is that we have this, this title that gives us the ability to treat a human being and get behind the symptoms that are presenting, because often that is just a presentation of something that has been going on for a long time. And it's often about the lifestyle, it's often about the habits. And this is where our generalist approach is now coming to be more important in a setting where we are seeing more and more chronic, kind of lifestyle related non-communicable disease, whether it's diabetes, obesity, even things like heart disease. We can have a really significant impact. So I suppose that leads us into the question, what is osteopathy? And we have this definition. The school that we were taught in is naturopathic by nature, meaning that we place an emphasis on lifestyle factors. So the definition, according to the British College of Osteopathic Medicine, where me and you were so fantastically lucky to meet, is a patient-centered approach for a wide range of medical conditions. But I find that quite vague, don't you? I mean, it doesn't, it's not massive, it's not really that specific, is it? So we have to try and help the layman understand what we do. And again, it goes on to say that osteopathy it's based on the principle that good health and a harmonious interrelationship of the skeleton, muscles, ligaments, and connective tissue are crucial to an individual's well-being. Again, quite ambiguous, quite vague. Not, if I said that to a patient, they would probably be like, what does that mean? So,
I think that shows quite clearly how osteopathy relate, and it is at the service of human complexity, because we talk musculoskeletal, but just to mention an aspect, a big, huge one, pain. When you say musculoskeletal pain, immediately we know nowadays, after all the research of the last 15, 20 years, we know pain goes far beyond the idea of pain is here. It's here. No, pain isn't
biological.
It's all encompassing. Pain is my perception of pain, what I feel, how I cope, what I experience, what impact it has on my mind, on my body, on my social interaction. So that's osteopathy is absolutely about, the good old onion metaphor, the system, so many layers, peel and peel. And that's about the complexity. That's about the idea of a holistic, omni-comprehensive therapeutic approach that as a matter of fact, gets into, as we said, into lots of layers. Sometimes I feel personally like the amazing, one of the amazing aspects of being an osteopath is an long life learning through, you always have to learn. Nutrition, mindfulness, meditation, exercise is so broad, but at the same time, you feel like you got so many tools, you got so many aspects and things that you can do with osteopathy, and that's the greatness, but obviously the challenge.
Yeah.
So it's
because we've got this flexibility with what we can do, but there's also this mystery and ambiguity. So as you said, and we mentioned earlier, osteopathy is a broad church. So aside from the education, osteopaths may want to specialize in the visceral aspect, working with the gastrointestinal system and the organs. You may have more craniosacral based osteopaths who like to focus on the the movement of cerebrospinal fluid and the energy or the energy work and connection between the movements of the fine movements of the cranium and how that may affect somebody's overall kind of health. So there are these kind of I would say they're specialisms that people tend to choose, and I think it really relates to what resonates with the individual. I remember
Absolutely.
at school when we did craniosacral, some people really took to it and found that they thought or they felt that it was something that was very effective. Others, it kind of parted the cohort, didn't it? There was some who were like, oh, I can't get with it, and some that really resonated with it. So, we talk about evidence-informed treatment. We like to try to use some form of evidence as a basis so that we feel grounded and we feel as though we can explain to our patients with research and confidence that what we do has a positive effect. But the bottom line is that we know that the body, whether it's through expectations, the placebo effect, previous experiences, we can administer treatment ourselves with our own expectations. So we can't really discredit or disregard any one approach, but what we can say is that in the face of these kind of growing epidemics of lifestyle related non-communicable disease, there are some very essential components of treatment that we have the opportunity and the autonomy to deliver. And as you mentioned, whether it is lifestyle medicine, mindfulness, positive psychology, motivational coaching, alongside our hands-on treatment. So it really is about building this relationship with each individual to empower them to make the changes, because what we do is just facilitating. What they do is the most important thing. And one thing that I do object to is this patient-practitioner reliance, where the patient feels it's the practitioner that's actually creating the change or the benefit. And we know now there are lots of, pioneers out there, whether it's the Meekins and the Cormacs who are talking about, this is BS and this isn't working. But at the end of the day, touch therapy is a way of building a relationship. And it does have some sort of beneficial effect for somebody who expects a beneficial response. So it might not be specific, but it has benefits. So we have all these tools at our hands to really, how would I say, lay the ground and plant the seed for lasting, change, resolution, rehabilitation, and better health. So yes, osteopathy is a broad church, but in today's medical terrain, in today's health landscape, we are becoming more important on the front line of healthcare, where the medical health system is maybe struggling with a more reductionist approach.
Absolutely. If you think that in the UK, at the end of the day, at the present time, osteopathy is one of the 14th health profession recognized by the Department of Health. So we are allied health professionals. And that means that we are nowadays, in comparison to, let's say, 10, even 10 years, 15 years ago, we are highly employable in the national system, and that give us a lot of credit, professional credit, ethical credit. So that has made a huge difference in our how we've been recognized.
Yes.
And that's very important, because yes, there is that element of I dare say art, medical art, therapeutic art, that is more, as you were pinpointing, is stronger in cranial, is stronger in visceral. Thank you. That it can be in structural. These are all different terms. As we said, there is an element of medical therapeutic art, but at the same time, we are much more recognized than in the past, and that's a very good, important thing. There is a lot to do, and now even let's say the official medical establishment is realizing that. So it's
and I think we've been in the grip of specialisms, and what we know now is this kind of Cartesian approach to healthcare, where it's a one disease, one intervention model. We realize that the complexity of disease is such that we need to be more general, we need to be more person focused, and that's why osteopathy really is growing in importance. And look at what we're facing now, this disease pandemic. You know, it's more aggressive in people who are immunocompromised or have comorbidities. And a lot of these are metabolically driven, whether it's diabetes, metabolic syndrome, obesity. And these are the things that we, as I would say, professional generalists, are able to effectively reverse and resolve, as opposed to just looking at one aspect, whether it be a drug for insulin or whether it be one modality for one symptom, medication for the blood pressure, or something for atherosclerosis. The myriad and complexity of symptoms that present from something like metabolic disease can be, you can swim upstream and really attack it at the root by addressing the human being. And this is where osteopathy really has power. So I think that the age of the specialist is now being challenged by the age of the generalist. And I think we should be proud that we are general and patient-centered, as opposed to trying to help people understand what we do by saying, well, I treat this or I treat that. Because I always find it difficult when somebody says to me, what do you do? Is it bones? Is it muscles? And I'm like, no, I'm treating you, the human being.
Absolutely.
And you need a little bit of time to explain, but it's almost like people want you to say something very short and specific that helps them clarify exactly what you are. But I think osteopathy needs to come out of the mist. It needs to come out of the ambiguity and be like, look, we're treating you, and we're looking at all the things that might be presenting this symptom here and now. So, I think this is, I think we're really helping to clarify what we do as a profession. And here in Qatar, I am the only, well, as far as I can see, the only registered osteopath in Doha. And so, yes, Europeans like the French, Canadians as well, French, the Spanish, the English, obviously, they recognize osteopathy more, but the local demographic, because it's quite Americanized out here, chiropractic and physiotherapy rolls off the tongue. So I'm trying to establish osteopathy, and I always find it hard to give a quick soundbite as to what I actually do. But hopefully with this video, we can, people will start to go, oh yeah, I see. And the relevant.
I also think that when you try to, quite rightly, when you try to identify, to give a good idea of what osteopathy is, what chiropractic is, what physiotherapy is, you realize pretty soon that there is an overlap in some respect among professions, because after all, you can call us, me and you, osteopath, you can call that man a chiro or the other man a physio. But when the patient is in the room, he's a human being, we are human being, that immediately there is a very deep interaction that goes far beyond the specialism. Obviously, we stick to our specialism, but there are other aspects that, as I said, make all these professions overlap. Empathetic listening, understanding, collecting a thorough case history just and understand where the person comes from. As I said, being very empathetic, professional, and it's down, as you said, about the therapeutic alliance, and that is cross-sectional. So the important thing is for the patients to know that the osteopath is healthcare professional who, as you said, goes at the, as much as possible in depth and try to find causes of the problem, of what the problem can be. But at the same time, is about more and more, I don't know what you think, Ricky, is more and more about empowering the patient. Try to help the patient realize what amazing results little changes, daily changes can do in daily life, on top of our manual expertise, on top of our advice. It's just down to, there's nothing more fulfilling than a patient, taking the responsibility of their condition in their hands. And we are there for that, like the chiro, like the physio, but with the differences. But that's, I think, is what's really important.
Absolutely. And just harping back to this kind of patient practitioner reliance, I like to see it as a partnership, a teamwork. And I always say to patients, look, an active participant is going to get more benefit than a passive recipient, somebody who just wants to receive the treatment. But unfortunately, a lot of, whether it be osteopaths, chiropractors, they build this relationship which builds a reliance, because unfortunately, there is, in private practice, there is unfortunately healthcare meeting wealthcare situations. So I want to dispel some of the myths around what we do. I mean, we do all of the things that chiropractors do with regards to manipulation and spinal mobilization, joint mobilization, but how we bring that across to the patient is really important. So if we're talking about alignment and things like that, we know that a lot of that, that is very
well supported.
Not well supported.
Not well supported, yeah.
But a patient expectations need to be met in some way, shape, or form. And so when patients have how would I say, had good feedback or felt better after certain treatment modalities, yes, we want to be a partnership in that. So we may use joint mobilization, joint manipulation, soft tissue massage, dry needling, breathing techniques. All of these are kind of skills within the osteopathic, kind of remit that we can deliver. So hands-on, yes, but our hands-on really for people like us is a kind of pathway into building the relationship to get the patient empowered and bring them on side and get them actually, working for themselves and feeling as though they have control, confidence, and the ability to modify their symptoms without reliance upon treatment. So it's all about looking at the bigger picture, but we use the hands-on, we use the nutrition, we can use the mindfulness, we can use the motivational coaching. There's so much. I mean, it depends on how we choose to approach our patients. I think we're all shooting at the same target, maybe with different arrows. So I'm not criticizing any form of profession, but what I would say is that when people ask me what the difference is between a chiro, an osteo, and a physio, I will say there are good ones and bad ones. The good ones,
yeah, absolutely.
good ones will use a host of modalities to treat you as an individual. The bad ones may try to build this dependence where you are reliant upon their treatment for some form of, positive outcome. So, it is, again, it's a little bit ambiguous, but I think we've really nailed it with what we've talked about. And I think, as I said, in today's health landscape, what we do as professional generalists is more important than ever. And so I encourage anybody out there who is curious about osteopathy to come and seek us out, because we treat people. It's not just, a 10-minute appointment where we're, meting out kind of reductionist treatments. We are focusing on you, your lifestyle, your apprehensions, your fears, your expectations. All of this is coming into play. So Massi, amazing. I've loved this brief chat, and it is too brief, but we're opening up these conversations. And I will say, we will touch on one subject, which we will lead into the next conversation. And this is philosophy, because I believe that during this time, we have both found, well, you basically introduced me to the philosophy of Stoicism. And I found it so helpful at a time when the world around me is changing very fast and everything is so unpredictable. And just by focusing on my responses instead of trying to change what is, I felt so empowered. And on the subject of empowerment, we can start to talk about the things which build empowerment in people, because we meet so many people who feel disempowered. I can't control my pain, I can't control my weight, I can't control my body. And this is the ultimate objective for us, is to get people feeling empowered so that they can fly. They can.
And I think that the amazing thing about some ancient philosophies, we are talking about Greek, Roman philosophies 2,000, 3,000 years ago, it's just they are so actual at the present time. Yeah. And you can use it that you don't need to feel like you are out of your remit, professional remit, because it's down to common sense. It's down to reminding ourselves that there are some very powerful, I would say, not simple, not easy, but simple. It's always about empowerment. They are there if you're ready to put and to make a bit of effort gradually, but they are so powerful and they don't require any specialization. They don't require anything but just to be looked at and be taken on. That's brilliant philosophies. Yeah.
Absolutely. Well, one of my philosophies is that people by people, not interventions or healthcare modalities. And we are both very passionate about what we do. We both live what we preach, and I think that's very important as well. And I think this whole idea of allowing people, inspiring people more than anything, because inspiration heals. Not just medical healthcare modalities. I believe it's people feeling inspired, and I think we can take a lot from the fitness industry, because you have these role models, people who stand up and lead the way and bring people along and inspire people. And I think healthcare could learn from that, where we are inspiring people with philosophy, with what we do, with our lifestyles, and really bringing people home and giving them the confidence. Well, I can do it.
You are a champion of that, Ricky. You eat amazingly well. You train. Now, you know what I mean. Jokes apart, I think that we should be the people, and it's not an aesthetic, cosmetic matter. It's just if you see someone that moves well, tends to have a good eating regime, automatically you see a person that is investing on the future, on their life.
Yeah.
for whatever reason, for family, for being here as long as possible. And that should be a characteristic of any healthcare professional. I don't know if you tell me that you tell me that I need to fast, or I need to be careful with malnutrition, and you're overweight, it doesn't sound good.
Well,
as a professional, no?
Living the experience gives us a more authentic and more deeply empathetic point of view, and also a kind of delivery as well. So, I'm not being holier than thou, and I'm not being elitist, but I say that as a passionate practitioner, I'm not going to suggest things to people that I haven't done myself, because I need to be able to understand how difficult and how challenging these modalities are to incorporate into our lives. And if I had a pill for motivation, inspiration, I'd be a very rich man. But at the end of the day, fighting the good fight, we're passionate, and that's what drives us. And this is the first of many conversations, Matt, and I really can't wait till we connect again. So thank you very much for sharing.
Thank you.
And
thank you for having me here.
And any other,
thanks. It's always good to see you.
Yeah, always. And I hope you get back into that clinical setting soon. I know that you're furloughed at the moment, but stay strong. We will connect again soon. And this is a really great opportunity and an avenue to share what we do, and really kind of bring more light to osteopathy and establish ourselves as the forefront of healthcare.
Thanks for having me.
Yeah.
Take care, Ricky. Bye. Take care, everyone. Bye-bye.